The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome to HDSA's Caregivers Corner webinar series. Before we begin our presentation, I'm going to go over how to ask questions as well as how to access this presentation after broadcast. Questions will be answered after our presenter completes her presentation. However, you can send a question at any time. To send a question, just go to your control panel that appears on the right-hand side of the screen. You'll see a panel for typing in questions. After you type them in, just hit send. And again, they will be answered during the last 15 minutes of the presentation. To view the webinar, you'll be able to view this webinar again on the HDSA website approximately one week after broadcast. To access it, you can go to www.hdsa.org and scroll down to the homepage to the frequently used shortcuts section on the right-hand side. You will see a link to the Caregivers Corner webinar series, as well as the old PowerPoint presentations. You can also access Caregivers Corners by going to the Living with HD section on the HDSA website. And now I'm so pleased to introduce Lisa Kerr, who's going to talk about care for the caregiver from a social worker perspective. Lisa is the dual social worker for the HDSA Center of Excellence at UC Davis, as well as for the Northern California chapter of HDSA. And now I'm thrilled to turn it over to Lisa.
Thank you, Jane. So I just want to say good morning and good afternoon, I guess, to those of you on the East Coast. And thank you for attending today and listening. And I think can you guys see this correctly? I'm not sure if I'm doing this right or not. But so thank you for attending today. So today we are going to discuss how we can care for the caregiver. So you guys as caregivers work very, very hard, and a lot of times your health and your emotional state goes by the wayside, and people are less concerned about you and more concerned about patients. But today we're going to talk all about you and make sure that you're getting the best possible care that you can so that you can also provide good care. So as you guys all know, that caring for a loved one with a chronic progressive illness like Huntington's disease can be both physically and very emotionally demanding. The combination of loss, prolonged stress, physical demands, emotional tolls can all put caregivers at risk for significant health problems and can also compromise your ability to take care of your loved ones. So today we're going to talk a lot about caregiver traits. Obviously, you guys all have these traits on how to be the best caregiver you possibly can. So we're going to talk a little bit about that. We're going to learn the importance of taking care of yourself. I have some statistics that are really pretty alarming that hopefully will encourage you to take care of yourself. We are also going to identify the impacts of caregiving can have on both your physical and emotional health, what some of the symptomology might be if you're having problems. And then also, probably most importantly, we're going to discuss strategies to improve your self-care. So little things that you can do to maybe make your life a little bit easier, improve your health, as well as improve the care that you provide to your loved ones. So first and foremost, caregivers are a unique group of individuals that possess a variety of traits and wear many hats on a daily basis. Every minute of every day is a balancing act for our HD caregivers. You guys are patient, you have a lot of strength, you're creative, flexible, very courageous. You pull energy from I don't know where sometimes. You guys are very committed to caring for your loved ones, very compassionate, caring, loving. Obviously, you guys are true leaders, and you have a lot of knowledge and understanding about HD in general. I just wanted to point out that it is very important. You guys do all, as caregivers, possess these traits, and sometimes we forget that we have all these strengths, so it's important to remember that we do have those strengths. So next we're going to talk about some caregiver statistics, which I'll warn you in advance that these are not meant to scare you, but rather to just demonstrate what could happen as a caregiver. And hopefully this will make a case for making sure that you care for yourself and that you put yourself first sometimes. So about 1 in 10, or 11% of caregivers, report that caregiving has caused their physical health to get worse. 23% of the family caregivers caring for a loved one for more than 5 years or more report their health as fair and poor. That is a very alarming number. Specifically, HD caregivers have reported that they have a diminished health-related quality of life, with 43% reporting that they were dissatisfied with their overall quality of life, which essentially means that half of our caregivers that are providing care to a loved one don't feel that they have a good quality of life or that their health is very good. And that is very alarming, because in order for them to adequately care for loved ones, they need to be healthy themselves. So now we have our HD person who is obviously, going through a lot of challenges and very sick, but now we have the caregivers that are also sick, which is not good. Caregivers are also less likely, according to studies, to engage in preventive health behaviors, which is what we're going to discuss today, some things that you can do to prevent some of these things to happen to you so that you're not part of the statistics. Studies also consistently report higher levels of depressive symptoms and mental health problems among caregivers than among your non-caregiving peers. That's important to remember, because while caregiving doesn't necessarily mean that you're going to become depressed or have mental health problems, it does add to your level of stress and the level of feeling overwhelmed and some of those things. So it is important to kind of keep that in mind. Estimates also show that between 40 and 70% of caregivers have clinically significant symptoms of depression, with approximately 1/4 to 1/2 of these caregivers meeting the diagnostic criteria for major depression. And that's important because major depression can impact all areas of your life, both physical and emotional, and it's definitely going to impact your ability to care for someone else. So hopefully, I don't necessarily share these to scare you, like I said before, but mostly to demonstrate that there are some negative consequences to being a caregiver, but that doesn't necessarily have to happen to you. Most of these things, depression, your health, those things, you can participate in preventative behaviors so that you can prevent some of these things from happening to you. Next, we're going to talk a little bit about the impacts on physical health. So when caring for loved ones, it is most important to know your body and to be able to identify and recognize any changes in yourself. If you are in your best physical shape, you will be able to provide care for others. And if you are not in the best physical shape, then you will have limited abilities in providing care. So some of the symptoms of physical decline are a frequent illness and sickness, or feeling under the weather most days of the week. So that's a health decline. Feeling tired or not rested, feeling fatigued, exhausted, and not feeling like you can get up to do even one more thing is also a sign of physical sleep deprivation. Any increases in appetite or any decrease in appetite can also be a symptom that your health needs attention and that you need to speak to your primary care doctor. Any changes in your weight, both up or down, without significant intention, dieting, exercising, or knowing that you're eating really bad food to have the weight gain, can also indicate that there's something going on with you and that we really need to get care to you as well. Other symptoms are putting off or missing your own medical appointments, avoiding the doctor because you're afraid of what the doctor might say, and always, as usual, excessive use of alcohol, tobacco, or drug use can also be a sign that you are having some physical and or emotional problems that maybe you're trying to mask with the use of alcohol or drugs. It's important to know that any changes in your behavior or your routine that is out of the ordinary can be an indication that something is going on with you and that you are not in your best physical health. Next, we're going to talk about the impact on emotional health. This is somewhere that it can usually be less noticeable because oftentimes you don't have time to reflect on how you're necessarily feeling from day to day, mainly because you're so busy caring for others. But that said, it is important to determine if you're experiencing emotional symptoms as they can interfere with your ability to provide quality care to your loved ones, as well as cause a pretty significant health decline, as the statistics have shown. So some of the emotional symptoms that you could be feeling are feeling stressed all the time, feeling like if I have one more thing to do or one more thing goes wrong, I'm just going to lose it. Also, feelings of depression or sadness over a prolonged period of time definitely need to be addressed. You know, it's normal for some people to have some depression and some sadness. However, when it impacts your ability to get out of bed or impacts your ability to establish relationships with others or maintain relationships with others, that's when it becomes a concern. It is also important to note that men and women cope with depression differently. Men, and this is you know, a broad term, but men often will self-treat with alcohol or overworking, and a lot of times women will dismiss these feelings as normal or just a normal part of life. Either way, this untreated depression can have numerous negative impacts on your life as well as your ability to care for your HD loved one. So it is important that if you're feeling any signs of depression or any prolonged sadness, that you talk to your primary care doctor and you see if there's something that can't be done to help kind of alleviate some of those feelings. You may also have feelings of guilt, feelings of anger that you don't know how to alleviate. Sometimes you have anger outbursts that may be out of your character. That's a sure sign that you're kind of overwhelmed, overworked, and need a break. So if you're having any of those things, maybe you can try some of the self-care things we will talk about later. You may also be experiencing some frustration, impatience, or anxiety, worrying about life stressors, worrying about how to care for your HD loved one, worrying about what's going to happen to your HD loved one. Those are all things that can lead to poor care as well. Also, being a caregiver can tend to be isolating and cause you to withdraw from social situations outside of what you're already doing for your caregiving responsibility. It's important to know that if you are isolating yourself or withdrawing from friends and family, it is important to know that that is a negative consequences, probably does have a lot to do with emotional health, may have some depression, frustration, grief, some of those things going on. And the way to overcome that is to kind of re-engage with some of those people and participate again. And, you know, your health will improve. So it's important just to remember that to be an efficient caregiver, you absolutely need to be in your best possible emotional health as well as physical health. And the two of them work hand in hand. Depression does have physical symptoms, and some of the physical symptoms can cause depression or other, you know, emotional health issues. So it's important to know that your body is in balance. So anything that's going on in your head, stress, different things, will manifest itself in physical sort of ways. So it's important to get those two in balance so that you can be at your healthiest. So some of the strategies to improve self-care. So I will just tell you right now that I know making you a priority is going to be difficult. It's easier said than done, but I will tell you from my experience that once you making little incremental changes, you will start to see a benefit and it will improve, and you will start to see the benefits, and you will want to continue to do this. If you can try to do it, small things at a time, small baby steps, making you a priority. If it's even 5 minutes a day, then once you do that for a week, go up to 10 minutes a day for a week and kind of build it in that way, build it in slowly. But once it becomes a part of your daily routine, it will be incorporated as just a normal part of life. So today we're going to be discussing each of these strategies in great detail, but the first is to educate and plan for your future, and that's knowing about, well, we'll talk about it more, but also utilizing stress management techniques, how you can reduce stress so that it can be at least at a manageable level for you, how to effectively communicate. A lot of times if you're feeling depressed or sad or frustrated or angry, our communication definitely declines, and we're going to talk about how to be most effective in your communication. Excuse me. Next, we're going to talk about exercise. Of course, studies have shown that exercise can improve significantly physical health as well as emotional health for all people, including caregivers. So we're going to talk a little bit about exercise. It's important for you to use community and social supports because there is, while it is limited out there these days, there is community and social supports for you, and it is important to know what those are, who those people are, so that you can use them and improve your situation. And also remember to ask and accept help. It's really hard for all of us to say yes when someone asks if we can help them because we all kind of want to pull ourselves up by our bootstraps and do it by ourselves. But yes can be a very, very powerful word, and you can get a lot of people on your team by saying yes and accepting help because none of us can do this alone. So next is educating and planning for your future. So educating yourself about HD, the disease process, the different stages, how your HD loved one might decline, what functional limitations tend to be present at the different stages, etc., can all help you identify earlier what types of assistance and what type of help that you might need now or even in the future. So planning ahead and knowing what resources are available, like respite resources, long-term care resources, support groups, adult day health care, etc., are all available in your area and can prevent stress and avoid urgency in the future. So the more you know now, the more prepared you can be for things that come up for crisis situations. So making sure you do your research on resources before you need them is going to be the most beneficial in reducing stress and anxiety. I get a lot of phone calls from patients that, are in crisis situations. Their HD loved one may be declined, and they're so overwhelmed that they can't even possibly find resources out there to help them. If we can find those resources before you actually need them, you know who to call in those crisis situations so that it's less traumatic for both you and as well as your HD loved one. It's also important to be involved in discussing finances and healthcare wishes. Discussing healthcare wishes is not always the funnest topic to discuss. However, it's really important to talk about what your HD loved ones or what you would also like at end of life. What are your wishes in regards to intubation, feeding tube, antibiotics, pain medication, all of those, quote unquote medical things. How do you want to, what does quality of life mean to you? What does that look like to you? Some of those discussions, which are not easy to have, but definitely need to be had so that you know what your HD loved one would want in specific situations, as well as discussing finances and seeing what really you have out there, including long-term care insurance, savings, investments, property, trust, living wills, all those types of things. Make sure that you know exactly what's going on with your finances so you know where there's areas where you kind of need extra resources or where you don't need resources, or where can you pull other financial resources to help pay for other needs. Some of those things. It's really important to kind of have a big picture of what's going on with you, both from a medical standpoint and from a financial standpoint, so that you can best care for each other. Also, consider meeting with family and friends to discuss a caregiving plan, meaning we don't want our HD caregivers to do this alone. It's important to involve family and friends because that's going to prevent burnout, reduce stress, reduce anxiety. And to be honest, most of the time family and friends really do want to help, but they don't necessarily know how. So by sitting down and discussing a caregiving plan, each person can kind of pick the tasks that they're willing to do for each other, and then you'll have people assigned to those specific tasks, and you yourself, as maybe the primary caregiver, won't need to worry about those things. It's also important to make sure that should you get sick or be unable to care for your loved one for whatever reason, that you know who you can call to assist you as needed. This person obviously will need to be someone that's dependable and someone that you trust to care for your HD loved one in your absence. It's also important to get organized. Easier said than done, I know, but it's important to make sure that you have your important paperwork, list of doctors, medications, medical documentation, both for yourself and for your HD loved one, in a readily easy to find place should you need them in a moment's notice. And as always, if you have any questions, make sure that you ask them when you have them. So if you are at home and you're not really sure what to do in a certain situation, you can contact your HD team, your care provider team. You can contact the social worker nearest to you to kind of help problem solve situations and to ask questions and to get your questions answered. It's really important not to just say, oh, well, I'll figure that out later. If you have the question now, you should probably figure it out now if you can. Next, we're going to have self-care strategies. It's important to, one, recognize your emotional and physical symptoms. Acknowledgement of those symptoms is going to be the most important key to managing stress. If you haven't recognized that you're depressed, you're going to ignore it, and that can be detrimental to your health. It is important to remember that we all have some stress. We can't get rid of every single stressful thing in our life, unfortunately. Some we can control and reduce with changes in lifestyle, and some things won't change, such as your loved one having HD. That's a stressor in and of itself. We can't change that, but there's other areas that you can change. It is important to use a team approach to accomplish your daily tasks so that you can focus on other needs. So asking neighbors to mow the lawn, transport children, rake leaves for you, etc., can all be very helpful. Of course, exercise that is regular and consistent can be an excellent way to reduce stress and to make it more manageable. Always making sure that you participate in enjoyable activities. If you used to like to go out with your friends for dinner or for a beer or manicures, definitely make sure that you build time in so that you can still do that even if your HD loved one cannot join you. Keep in mind that HD patients face a lot of great challenges, and to reduce stress and frustration for both of you, make sure that you have realistic goals and expectations given your situation. It's important to know that HD patients can do a lot of things, but they can't do everything. So it's important to know what they can do, not necessarily what you think they can do. So breaking down things into smaller tasks for them will reduce the expectations. Laundry sometimes can be very hard for them to do, but they could probably separate whites from colors for you or do some of those things. So making realistic expectations and goals for yourself as well as your HD loved one. And always remember to laugh. Very important. I think there's studies that show, I don't know the exact statistics, but there's studies that show that children laugh, how many times a day, and adults laugh half that much, and children are much healthier, obviously, than adults. So remember to laugh a lot, rent funny movies, read comments, laugh at yourself, even laugh at HD, which sometimes is really hard to do. And of course, using relaxation methods like yoga, meditation, deep breathing, reading, bubble baths, of course, sleeping, and creative outlets, artistic outlets, and also outdoor activities like gardening and walking can also be a great way to reduce stress. Next is communication. So effective communication, I think we can probably most agree, is going to be essential to a successful relationship. And caregiving is really a relationship that you are developing or have developed on top of the relationship you may have already had with the loved one. Meaning if you were a spouse, you're now a spouse and a caregiver, which definitely has an extra layer and an extra component of difficulties and challenges, because now your previous role, supportive role of maybe being a spouse, has changed into more of a caregiving role. So using I statements rather than you statements to express feelings can be used to avoid defensiveness or blaming others. For example, if you can use, I feel angry when there's yelling in the house, versus you make me angry when you yell in the house. So really trying not to blame others and just expressing what it is that's frustrating you or what it is that's upsetting you in an I form can sometimes be a little bit more helpful. Sometimes easier said than done is respecting the rights and the feelings of others, allowing them to express their feelings, and for you yourself trying to avoid internalizing those feelings. It's also important to remember that HD patients can be very impulsive and sometimes say hurtful things without them recognizing them as hurtful. It's pretty normal for them to say some things that maybe they don't recognize as hurtful, but that does not mean that you are not being a good caregiver. That is part of the disease process, and it is important not to kind of internalize that and make that the truth, I guess, if you will. It's important to be clear and specific about what you need or what you want. Don't try to avoid hinting or expecting the other person to guess what you need, because this will avoid any frustration and misunderstandings for you. Actively listening so you can directly and respectfully address what is being communicated is always good. And as always, being honest and genuine in your communication with others is going to be the most important. So if you're upset with someone, it is okay to tell them that you're upset. And if you are happy with something that someone is doing, it's okay to tell them that you're happy with what they're doing. So being honest and genuine is going to be the best way to communicate with others. So next we have exercise. So as we know, exercise has many benefits to both our physical and our emotional health. Some of the benefits, it can improve sleep, reduce stress, reduce tension, can reduce feelings of depression and sadness. It can often help you feel like you have more energy and you feel more alert and awake. It can improve your endurance, allowing you to feel like you're getting more done throughout the day. Who doesn't want to get more done? It will also improve strength, balance, flexibility to help you care for your loved one. Of course, daily exercise is always best. However, that's not always feasible. But remember, it doesn't necessarily need to be strenuous weightlifting or running marathons or anything like that. It can be hiking, walking, raking leaves, shopping, walking the dog, biking for morning coffee, or going to the farmer's market, or group exercise classes, tennis, boot camps. There's all kinds of things out there that can fulfill the daily exercise requirement, but don't necessarily have to be strenuous. Most important is to find activities that you enjoy and that you can incorporate into your daily life. So if you know you're going to the grocery store, you can park a little bit further away from the front door so that you have to carry the groceries a little bit farther and you have to walk a little bit farther to kind of get some of your daily exercise in. Like I said earlier, finding time can be very difficult, but if you can slowly work it into your daily life, you will likely start to see the benefits and try to find other ways to increase your activity. And as always, find activities that you enjoy. If you don't enjoy running, don't run. If you don't enjoy walking, don't do walking. Maybe you can find a group class, a dance class, some other sort of class that might be interesting to you so that you and your friends can go do that. And sometimes even you and your HD loved one can maybe, walk down to the park or the farmer's market or something like that that you might enjoy together. So utilizing social and community support. So social supports can consist of family, friends, neighbors, church, coworkers, other HD families, anyone within your social system that you would consider people that you socialize with or supportive. And then community supports can include your healthcare professionals, any of the HD organizations, HD support groups, and then all social service organizations that are out there in your community. So it's important to utilize those. So asking and accepting help is often difficult for people. But it's important to know that you do have a social support system and you do have community support of people that are out there waiting for you to ask for help. So it's necessary to identify early what resources you have available to you both now and in the future. Don't expect others to necessarily just offer. Oftentimes they want to help but don't know how. And participation in like HD support groups is going to be a great way for you to identify what support has worked for other families and what support maybe hasn't worked for other families. It can also help you feel less isolated and alone, which can sometimes misery loves company sort of thing. So, it's important to know that you're not alone and that there is other people out there struggling with the same challenges that you are, and they just get it. And you don't necessarily, sometimes you can just look at them and they just truly understand what you're going through, and that can be so comforting in a time, and it can provide great relief to you. Utilize your support regularly. If you do have family, friends, and neighbors that are helping you out, definitely make a chart of when you can use them and continuously use them regularly as they're available. So asking and accepting for help, a lot easier said than done. Oftentimes we don't want to feel like we're burdening others with our problems, and we don't want to admit we can't do it all. However, reaching out to others for help can be a sign of strength and courage as far as I'm concerned. None of us can care for HD alone, and that's why we have the HD teams of professionals that work with HD patients, not just a doctor. So having a mental and physical list of ways others can help you can be a good start to accepting help. So the next time your family or friend asks, is there anything I can do for you, you can look at this list and say, yes, as a matter of fact, thank you for asking. Would you be willing to do this for me? Kind of fill in the blank. Some of the things you may feel comfortable asking for help with can be assisting with transportation of your children if you have children, transportation of your HD loved one. Maybe they like to get coffee on a daily basis, and it would be helpful if they could take them to coffee. Some of the household tasks, like walking the dog or mowing the lawn, putting out the trash cans, preparing meals, some of those things are relatively easy ways that people can help you and can take a lot of stress off of your plate. And then other things are sometimes family can assist with completing or mailing out benefit applications or forms. There's lots of forms to be prepared, Medicaid forms, Social Security, disabilities, all of those types of things. Those are things that sometimes your family and friends can help you fill out because they can be very tedious and they can take a lot of time. And if you can have family and friends kind of assist you with that, that can be helpful. They may also be able to assist with running errands. If your neighbor is going to the grocery store already and you know that, maybe you can ask him, can you pick me up some milk or whatever it is that you need. And then a lot of times family and friends, even neighbors, can be available to you to help keep your HD loved one company while you care for yourself. So, for example, if you need help with so if you consider their hobbies and their special abilities that they can assist you with, that can be very helpful. So, for example, if you have a neighbor that loves to cook, you may ask them if they would be willing to cook you a couple lasagnas or a couple casserole-type meals so that you can have that. If you have a loved one or a neighbor or a family or friends that likes to come over and likes to play games, maybe they can come over and play some games with your HD loved one while you go out and get grocery shopping or different things. Always make sure that you keep a list of what's current, of what your current tasks and needs are. Never try to resist asking the same person all the time for different things. Make sure you kind of spread the wealth, if you will. And it's important to be specific and direct with your request, meaning, you can ask someone, I would like to go to church on Sunday. Would you be available to keep my loved one company from 8 to noon? So being very specific, telling them exactly what you want. Remember, just as much as you have the power to say yes, they have the power to say no. So if they're not able to help you in that situation, they can say, no, I'm sorry, I can't help you today, but maybe they can offer something else for you. So hopefully we can all practice the power of saying yes and asking and accepting help. So next I kind of listed some resources that might be helpful for you. So HDSA has a care coordination portal, and it sounds really cool. I haven't been able to look at it myself, but it looks like you can both manage your care and administrative needs of your loved one, as well as find support from a network of other people that are going through your same situation. Looks like they have a calendar, can organize volunteer tasks and vital information to help you store health and legal data, which is really important these days, as well as some other community sections where you can post photos and well wishes and kind of have message boards and remain in contact with some other people and get positive information from people. So there's the website there at the bottom, www.hdsa.org, care coordination to start the community. That looks really interesting. Some other helpful resources that might be helpful for you is, of course, HDSA, which has a helpline, and the number is there for you. as well as any of the HDSA local chapters that may be in your area, or any of the Center of Excellence areas as well. Most chapters and most Center of Excellences have social workers. If you can get a hold of a social worker, they can help you problem solve, help you identify resources, help you get care for your HD loved one, those type of things that you may be seeking, and can help you manage your stress as well. There's always the HDSA support groups, like I said earlier, which are a great source of support, as well as a great wealth of information. Social workers are very good, but we're not walking in your shoes every day, and the people at the support groups are. And then there's lots of HDSA publications about HD and how to care for your loved one. There is A Caregiver's Guide to Huntington's Disease, which was produced with HDSA and We Move, which has a lot of good information about caring for loved ones. The Family Caregiver Alliance, which is a national organization, it's at www.caregiver.org, has lots of good information. That's where I got most of my statistics about caregivers and health-related issues. But they have a lot of good practical information about, you know, how to implement self-care, where to find care, where to find resources, long-term care planning, all those type of things as well. So there is resources out there. While they are limited, there are resources, and there's people that want to help you. And like I said, none of us can do this alone, which is why we have these resources here from HDSA for you. So to kind of recap what we've discussed already, being a caregiver takes a tremendous amount of strength, courage, and skills. We all want to be the best caregiver we can be, which requires that you do also care for yourself. Providing care to a loved one with HD will involve a great deal of changes to both your life, their life, and the lives of others around you. So your acceptance of what is considered normal will change and evolve throughout the course of this illness. That said, you will need to be able to be flexible and adapt, which requires you to be in good health both physically and emotionally. Make sure that you seek the medical attention that you need if you're having any of the symptoms that we discussed today or symptoms that are out of the ordinary for you. It's important to remember caregiving is challenging. You will have good days and bad days. It can be a challenging and difficult job, but it can also be one of the most rewarding jobs that you will do. Remember to reward and praise yourself for the love, commitment, and the efforts that you put forth every single day. Without you, you are an integral part of the HD team, so you are an extension. Without you, our HD loved ones would be lost. So lastly, I just want to say thank you for all the love and support that you give to our HD population, because caregiving is often a thankless job, and it's not that people don't want to say thank you, it's sometimes we just forget. So thank you, thank you, thank you for all that you guys do for our HD loved ones. And we can take questions at this point.
Thank you, Lisa, so much. And for everybody who's listening, just to recap, to ask a question, what you do is you type it in on your control panel and just hit send, and then Lisa can see them and answer them.
No questions. Perfect. Maybe everyone.
So we'll wait a few minutes to see if anyone has questions to type in. So.
It looks like there's a few questions here. So here's one. How do you keep from getting angry when something breaks from a fall, even though you know it's not the person's fault? That's really hard. It's not that you shouldn't get angry. Feeling angry is a perfectly normal part of life. What's important to do if you do feel angry is to have a way to kind of reduce that anger so maybe you don't take it out on someone else. So what I usually suggest is kind of taking a time out, that if it falls, say, I know you didn't mean to do that. I'm going to step aside here, take a few deep breaths, and kind of come back to the situation after that. It can be very frustrating, but getting angry over something that falls is usually a sign that you're probably a little bit overwhelmed and a little bit already previously frustrated. So you might need to do things like incorporate some exercise so that you won't feel as angry when some of those things happen. And you're already helping yourself, because if you know it's not the person's fault, then you can kind of adjust your anger that way. And the care coordination URL, yes, I will be more than happy to put that back up here. I don't know if you can see it because maybe my stuff is too high, but there you go. So hopefully that will be helpful to patients.
Hey Lisa, if you click on the link, you can actually show people what it looks like when they get there.
Oh, okay.
Something that you want to do.
Sounds good. Hold on. Jane, how do I make this question? Oh, there we go. Can people see that or no?
Yeah. And while I can see it, yeah. I can see your mouse moving. So what you want to do is you want to click on either one of the hyperlinks. Yep. And just right-click on it, and it should open it. Yep. There we go. And just while Lisa is doing that, let me just answer a few administrative questions. In terms of reviewing, having this presentation available for download, it will be available for view and for download approximately a week after airing, and you'll be able to do it on the HDSA website. Now there are a few other questions that do not.
There is a few other questions.
Okay, good.
One of them is, let's see. The closest HD support group is 2 hours away. My husband's doctor says I should attend a Parkinson's group nearby as it's similar to my needs. I don't necessarily agree. I would say I don't really agree with that either. You're dealing with different issues in HD than you are with Parkinson's. So there are online HD groups, support groups that may be helpful. And since you're online now, maybe you have access to them. And let me find them for you. Jean, do you know what they are off the top of your head? Oh, here we go.
The online support groups?
Yeah.
I know that there are a number of online support groups.
So if you go to www.caregiver.org, there is a online support group for it's Family Caregiver Alliance, Huntington's Disease and Movement Disorder Discussion Group. There's also a Family Caregiver Alliance Caregiver online group, and there's also a HD Soul, which is Significant Others United in Love, and that's a Yahoo group. So if you go to the caregiver.org site that I gave you, you can go to subscribe to the group. You go to the website listed, click on the Groups tab, and select the Caregiver Online group. Or you can select the Huntington's Disease and Movement Disorder group. And then that will give you at least some online support as well. The other thing is to try to attend educational events, and you might be able to hook up with other people that are in your area, and you can kind of maybe start a smaller group that may turn into a support group. So there's other options. Another question is, how do I deal with a loved one, his wife, who is reluctant to accept help? She's almost as stubborn as me. Stubbornness or lack of insight into kind of someone's disease process can be pretty common in HD. What I would say is don't get too frustrated. You can only work as hard. You can't work harder than the HD loved one. So if they don't want your help, you kind of unfortunately need to let them kind of make their own decisions and just continue to reach out your hand and to offer that help, and one day they will actually take your help again. So be patient is really what you can do in that situation, because you can't force anyone to not be stubborn, and you can't force anyone to do anything they don't want to do. Another one is, how are we on time? We're good on time?
We have about 10 minutes left.
Okay. How do we get over the guilt of wanting to leave to go to the gym even after the person has been home alone all day waiting for you? Guilt is a very hard thing to overcome. It's important to know that as much as they want you to be there and at home, it is also that much more important for you to take the care that you need and the time that you need for yourself so that you can provide care to them. So a way to get over the guilt is to go to the gym. You will still have some guilt maybe about leaving them alone, but the more you know that the gym is helping you kind of manage your stress, the more important it will be for you to continue to do that. And then the less guilty you'll feel, because you know by going to the gym you're not being selfish. You're increasing your ability to be more patient with them, to provide better care for them. So they're not going to understand that, but you do. So kind of reframing it maybe into a positive sort of way, that by me going to the gym, I can be a better caregiver or a better loved one towards you. But that's a difficult one. Guilt is always hard to overcome. Let's see. It is sometimes too much trouble to explain everything to a neighbor or a friend if I need to get away. Are there some already written forms available that I can fill in the blanks or help me get started with? Or help me get started with instructions and emergency contacts. There actually are some caregiver books out there. I would go to the Family Caregiver Alliance. They do have some helpful information regarding, how to kind of put that stuff together so that you don't have to re-explain every time you leave the house to a friend or a family or a friend or a neighbor that might not be familiar with HD. The other thing is maybe sitting down with them, if they're going to be someone that helps you on a regular basis, is sitting down with them and finding that 10 minutes to go over what HD is and kind of what some of the symptomology is and what some of the challenges are, so that they know ahead of time. There's also a few books out there. One is called, I think it's called Share the Care, which has some good ideas about how to kind of organize care and set up a care community. And I don't know the author off the top of my head, I'm sorry. And then there's the 36-hour day, which is a family guide. This one is specifically to caring for persons with Alzheimer's disease and other dementias, but it's by Nancy L. Mace and Peter Rabin, and it's actually really good about how to care for a loved one and how to incorporate and engage other people to help you. So there are some out there. If you are savvy with the computer, you can probably just do an internet search on caregiving books. Let's see if I can find the Share the Care book information.
I think it's available on sharethecare.org, if that's the one.
Thank you.
Of, Lisa.
It probably is. Thank you. Yeah. And I don't think there's any more questions unless I skipped any. I think that's pretty much it. Questions right now. caregiving thing looks amazing.
Yeah, it's a pretty cool tool, and I know that a lot of different organizations and groups use it to coordinate care and volunteerism. So hopefully people will be able to take advantage of it and find use of it. It's completely free for the user, so yeah, we hope it's useful.
Perfect.
So we are we're a little bit past the 5-minute mark. So if anyone has any more questions for Lisa, please send them right now.
One more question. Would a daycare program for head injury patients be appropriate? It could be. It would be important to go and look at the facility and talk to the staff about what kind of care it is that they provide to the patients. Most daycare programs, at least here in California, do both head injury as well as dementia and Alzheimer's, as well as cancer and other things as well. So, so it can be helpful. The thing with head injury patients, sometimes they're mobile, sometimes they're not. HD patients, as you guys all know, are pretty still intact as far as alertness, and just because they can't necessarily talk to us or write down what they're trying to express to us, they understand everything that's going on, which might be a little different for head injury patients. So it'd be important to go to the facility, let them know what your needs are, and let them decide if they can meet those needs. And then you can also observe it and see if they would be a good fit for your loved one. And that's important for all resources that you're going to use, is that not all resources are going to be appropriate for your loved one. So it's important to talk to the staff and see if it's someplace that you even would trust sending your loved one to, and whether you think it's somewhere that they would actually enjoy being while they're not in your care. Good question.
Okay, so we're at the 2-minute mark. We have time for one more if anyone has anything pressing, or if you think of something later, you can always contact me, that's Jane Kogan, and I can get it to Lisa.
There's a question here about mentioning talk therapy. I didn't mention talk therapy, but that can be, a great way, of course, to help with some of the emotional stressors that you might be going through. That's really a decision that you should make both with your primary care doctor as well as any social workers or other people that you would include in your care. But talk therapy is absolutely available and can be very beneficial. And then someone asked if they could have my email. Absolutely. My email is lkjer@hdsa.org. So please feel free to email me if you have any further questions or concerns or need help problem solving a situation. So again, that email is L as in Lisa. My last name is KJER@hdsa.org.
Okay, well, Lisa, it is 1 o'clock. Thank you to everyone who attended, and thank you to Lisa for such an informative presentation. Again, this will be available for download from our website in about a week, along with Lisa's slides. And please do not forget to fill out the evaluation and give us your feedback so we know what to do more of in the future.
All right, and thank you to all the caregivers for all the wonderful care you provide.
Thanks, everyone.
Thanks, Jane. Bye-bye.